So they quite simply can call NorthStar. They will speak with one of our people who can explain the program to them in great detail. We can explain that to them, the person themselves, or to their loved ones who might call on their behalf, tell them all about the program. We have a questionnaire, series of questions that we ask them as well to determine where they're at in terms of their disease. And depending on the answers to that, we may also recommend that they speak with one of our physicians, one of our nurse practitioners, for example. If the patient's decided that they want to engage in treatment, the beauty of doing this from home is they can start the next day. We overnight a kit to them, and the kit contains all of the different components that they need to be successful in this program. It contains the first 90 days of nutrients. We can adjust what nutrients we give each patient in terms of the dosing and how much once we get their laboratories back. But there are classic things that all of these patients are ubiquitously deficient in, like magnesium, that need to be replaced. So we send a standard set out to patients and then further adjust once we have labs. We send them the breathalyzer. We send them the VR headset. Most people don't have a VR headset at home yet, so that's included in that kit. We send the genetic testing kit. We also send a blood pressure and heart rate monitor because as we're helping people to taper off of alcohol at home successfully, when we're doing that process, we have to be able to monitor their heart rate and blood pressure carefully. And lastly, we send patients drink substitutes. And we'll talk a little bit about drink substitution therapy and how that came to be and how we make use of that. It's quite intensive, actually. If you think about when someone would go into rehab, essentially from 9 in the morning until the evening, they're engaged in facilitated 12-step work or they're having individual counseling sessions. All of those things are happening during the day. So that's a full day, 6 days a week of that, of that time that they're there. With NorthStar, we're essentially spreading that out over time. In the early weeks of treatment, the first week or two are pretty intense. It's 10 to 15 hours, I'd say, at minimum for most patients, because they're meeting all of their team and getting launched in care, and we're identifying the right medications for them, getting their genetics, etc. All of that's happening. Over that first 12 weeks or so, it's pretty intense. We're stabilizing patients. So, I'd say on average they're between 5 and 10 hours a week for the, initial several months of care once those first 2 weeks are established. From there, it really depends on how the patient's doing. They can spread things out in terms of how much support they get based on what they need. The patients really dictate it. If they're struggling, we're going to be there more for them. We don't place any limits on the amount of time. So there are patients who have needed 30 hours of support in a given week because they're in crisis and lots happening in their family and they need a lot of support. And they may get that from our nurses, our peer guides, our counselors. All of them can come in a crisis situation and help support them and their families. So it's a very intensive program that really varies over the year based on the needs of the patient. And we intensify the care when we need to, and we can give the patient, a lot of leeway to do what they need in their life if they're being successful. It's really up to them and their needs.